Okay, I'm doing my 60-second assessment. I'm noticing that the patient is sitting upright and his posture is good. I'm noticing that he's not connected to any tubes, machines. He doesn't have any oxygen. He appears well groomed and he looks like he practices good hygiene. Alrighty. Knock knock. Hello. My name is Emily and I'll be your student nurse today. I'm going to be giving you a health assessment.
Hi, Emily.
Can you tell me your name, your age, and your date of birth, please?
Jensen Azate, 28, 3/24/1992.
Perfect. And what is your code status? Are you full code?
Full code.
Okay, perfect. Alrighty, I'm just going to go over a little bit of medical history. Can you tell me if you've had any past medical problems?
Broken ankles.
Okay, and when did you have a broken ankle?
From 2000 until 2010, I had a broken ankle every year.
Okay. Are you on any current medicines?
No.
Okay. Do you have any current medical diagnosis?
No.
Any allergies?
Seasonal.
Seasonal, okay. And are you up to date on your vaccines?
Yes.
Okay. Moving on to your surgical history. Have you ever had any surgeries?
No.
Okay. Okay, then we can skip on down to your social history. Do you currently use nicotine?
Yes.
Okay, and do you smoke? Is it vaping?
Vaping.
Vaping, and can you tell me about how much you vape?
I don't know, a little bit.
Every day?
Yes.
Okay. What about alcohol use?
Maybe once a month.
Once a month, okay. Any recreational drug use?
No.
Okay, and can you tell me about your occupation?
I drive semi-trucks.
Okay, and how many days a week?
6 days.
6 days, and about how many hours?
9 to 16.
9 to 16, okay. Are you married or single?
Single, but I have a girlfriend who lives with me.
Okay. And what's your education level?
High school graduate.
High school graduate, okay. And you tell me a little bit about your diet. How would you say it?
Well-balanced diet.
Well balanced, good. And what about exercise? How many times a week do you exercise?
I exercise every day. I go to work about 30 minutes or so.
30 minutes, 6 days a week, perfect. And can you tell me a little bit about your cultural or religious background? Anything that's important to you that you would like us to keep in mind?
No.
What is your religion?
Catholic.
Catholic, okay. Alrighty, I'm going to move on to the health assessment part of my assessment. Can you tell me where you're at and what year it is?
I'm in my bedroom and it's 2020.
Okay, good. You are alert and oriented times 3. Your speech is clear. I can understand you. It's not slurred or garbled. Okay, I'm going to move on to the head and neck part, okay?
Okay.
So I'm just going to start off by feeling your scalp. Your hair is evenly distributed. There's no bald spots, no infestations. Is there any tenderness or pain when I feel around?
No.
Okay. Temperature is normal texture. I'm gonna move on to your eyes, okay?
Okay.
If you just look up for me, I'm just gonna lightly pull down on your eyelid and look at your conjunctiva. Okay, your conjunctiva is pink, moist, and smooth. And now I'm going to check your pupils in your eyes, okay?
Okay.
So I'm just going to quickly shine this light into your eyes and check for reactiveness, okay?
Okay.
Good. Good. Sorry, I know that's bright. Just go ahead and follow this with your eyes only, okay? Okay, pupils are equal, round, reactive to light, and accommodation, so that's good. I'm gonna move on to your mouth. Can you open your mouth? Good, now lift your tongue. Alrighty, mucous membranes are moist, pink, and smooth. So that's good. I'm gonna move on to your lips. Your lips are dry, they're a little dry right now, but it could just be the weather. I know it's kind of cold out. I'm gonna move on to your neck now, okay? I'm just gonna feel your lymph nodes. Those are good. They're not swollen, hard. They're movable, so that's good. Any pain?
No.
Okay, I'm just gonna look at your trachea. Your trachea is midline. That's good. I'm gonna check your carotid pulses one at a time, okay?
Good.
Good. They're +2 gray. They're equal and bilateral. There's no frills. And now I'm just gonna osculate for bruise, okay?
Okay.
So I'm just gonna take a quick listen. Good. I don't hear any bruise. And then real quick, I'm just gonna grab your blood pressure, okay? Just gonna measure this cuff and make sure it's appropriate for your arm. Good. And it is, so I'm just gonna have you slide your arm in for me. Okay. Okay, I got 115/74.
Is that good?
Yes, that is within my normal range. Okay. Now I'm just gonna grab my watch real quick. And I'm going to move on to the cardiac and respiratory. So just the chest area, okay?
Okay.
And starting off, I'm gonna put my hands on the back of your back, and I just want you to breathe, okay? Good. It is equal bilateral on both sides. You don't appear to have any labored breathing, so that's good. Is there any pain or tenderness
No.
as I go around? Okay. I am going to go ahead and listen to your lung sounds, okay?
Okay.
So I'm just going to be moving my stethoscope around to different locations, and I just want you to breathe in each time, okay?
Yep.
Deep breath. Good. Good, now I'm going to do the same on your back. Breathe in. Good, everything sounded clear. There were no extra noises. Now I'm going to listen to your heart. So I'm going to have you lie down for me.
Okay.
You can just go ahead and lie down this way. Okay. Okay, so you can just go ahead and relax for this part. I'm just gonna take a listen. Okay. I'm gonna listen to your apical pulse for 1 full minute, so just relax and just focus on your breathing. Okay? got 64 beats a minute, okay? So now I'm just gonna listen to different areas of your heart. So I'm just gonna move my stethoscope around, okay?
Okay.
Good. Sounds normal. I didn't hear any extra sounds, and I did not know any heaves or thrills either. Okay. So now I'm just gonna check your different pulses. Can you hold your arms out for me? I'm gonna check your brachial pulses. Good. They're +2, equal, and bilateral. And now I'm just gonna check your radial pulses. Good, +2, equal, and bilateral. And now I'm just gonna count your radial pulse and compare it to your apical pulse, okay?
Good.
Yeah, I got 64 again. So that's good. Now I'm just gonna take a look at your hands, okay?
Good.
Just the fingers. Okay, your nails are short, round, and clean. Capillary refill is less than 2 seconds, so good, good. Your skin is warm, pink, and dry. I don't notice any lesions, no tattoos, no rashes. Okay. I'm going to move on to your abdomen, okay? First, what I'm going to do is I'm just going to take a listen to the different quadrants, okay?
Good.
Good, your bowel is active. Your contour is flat to rounded, which is normal. I'm gonna listen to your arteries now, okay?
Okay.
Okay, I'm not noticing any bruise. Okay, then your umbilicus is midline. Now I'm gonna go ahead and palpate your abdomen. Just let me know if you have any tenderness or pain, okay?
Okay.
Okay, I'm not noticing any masses. Is there any pain?
No.
Okay, good. There's no distension either. I'm gonna go ahead and check your femoral artery, okay? Or your femoral pulse. Good. +2, equal, and bilateral. Now I'm gonna go ahead and move on to your lower extremities, okay?
Okay.
Can I just have you bend your knees a little bit? Okay. I'm gonna check your popliteal pulse. Okay, +2, equal, and bilateral. Can I have you go ahead and bring your legs in close to you? Like that. Good. Now you can straighten out and lift both legs. Good, good, good. I'm gonna go ahead and assess your tibial, your posterior tibial pulse, okay? Good. +2, equal, and bilateral. I'm gonna check your pedal pulse.
Good.
Good. Let's do equal and bilateral. And I don't notice any edema. Your skin is warm, dry, and smooth. Go ahead and push in with your feet, will you? Okay, good. Now push out. And now push up. Now push down. Okay, good. 5 out of 5. And I'm going to go ahead and check your capillary refill. Good, less than 2 seconds. Okay. You can go ahead and sit up again for me. I'm just going to test out some range of motion. Turn your head side to side. Look up and down. Rotate your shoulders. Alright, can you hold your hands like this? Okay, press in. Press out. Give my hands a squeeze. Good. Now open your fingers. Close them. Make a fist. Good. Good. Okay. Can I have you stand up and walk in a straight line for me? Now come this way. Good. You can have a seat. Your posture is normal gait. Your back has normal curves. I'm not noticing any scoliosis or kyphosis. Alrighty, that wraps up my health assessment. Do you have any questions?
No.
Okay, I'm going to go ahead and give you the call-out, okay?
Okay.
And I'll send the doctor right in.
Okay.
Alrighty, thank you, Jensen.
Thank you, Emily.